Imagine a child sitting in a classroom. They can't sit still. They interrupt. They forget instructions. Their emotions swing from laughter to tears in seconds. To the outside world, it looks like just ADHD. But what if that child's brain isn't only struggling with attention? What if that same brain is also carrying the invisible weight of chronic trauma? For some children, the story is not ADHD or trauma. It is ADHD and complex post-traumatic disorder colliding in the same nervous system. And when that happens, symptoms don't just add together, they multiply. My name is 𝗪𝗪𝗂𝗪𝗂, licensed clinical social worker. Welcome to my YouTube channel. Research in developmental psychology and child psychiatry increasingly has shown that children as young as age 4 can exhibit symptoms of complex post-traumatic stress disorder when they experience chronic stress, instability, or relational trauma. Now, layer attention deficit hyperactivity disorder on top of that. ADHD already affects the brain's systems responsible for executive functioning, impulse control, emotional regulation, working memory. These functions rely heavily on the prefrontal cortex, the part of the brain responsible for planning, inhibition, and decision-making. Trauma, however, activates an entirely different system, the survival circuitry. The amygdala responsible for threat detection becomes hyperreactive. The hippocampus, which organizes memory, struggles to process experiences normally. Stress hormones like cortisol remain elevated. So instead of a brain calmly learning the world is safe, the children's brain is constantly asking, am I in danger? When ADHD and trauma coexist, the child's nervous system becomes both distracted and defensive. And that combination can be very overwhelming. So here's how the ADHD can exacerbate complex PTSD symptoms in young children. First, impulsivity amplifies the trauma responses. Children with ADHD often react before thinking. If they're already primed by trauma, small stressors can trigger fight or flight reactions, yelling, hitting, hiding, or shutting down. Second, attention dysregulation makes emotional processing harder. Traumatized children need supportive adults to help them make sense of their feelings, but ADHD makes sustained attention difficult. This means the child may struggle to follow calming instructions, stay engaged in therapy, process emotions in real time. And third is working memory challenges intensify fear learning. The child with ADHD may struggle to remember that a situation is safe now, even if it was scary before. Their brain keeps replaying the danger signal. And Number 4 is the emotional dysregulation compounds the hyperarousal. Both ADHD and trauma affect the brain's ability to regulate emotions. So this can show up as explosive meltdowns, sudden rage or panic, rapid mood swings, extreme sensitivity to criticism, difficulty calming down once upset. For children as adult as 4, this can look like intense separation anxiety, chronic irritability, aggressive outbursts, hypervigilance, disassociation or zoning out, distractibility, sleep disturbances, and nightmares. Adults may label those behaviors as defiant or bad behaviors, but in reality, the child's nervous system is overloaded. Their brain is trying to manage two regulatory disorders at the same time. So what can we do? What can the parents do? First is we must change the question. Instead of asking, why is this child acting out? We must ask, what has this child experienced and how is their brain trying to cope? Early screening for both ADHD and trauma exposure is critical. Children need environments that are predictable, emotionally safe, trauma-informed, structured, but compassionate. Therapies such as play therapy, trauma-focused cognitive behavior therapy, and parent-child interaction therapy can help regulate the developing nervous system. And parent education is very important. And perhaps the most importantly, children need adults who understand that behind the behavior is a brain still learning how to feel safe. So when we recognize the interaction between ADHD and trauma, we move away from punishment and towards healing. Behavior management plan is one of the best things that you can do for ADHD child, because every child deserves more than survival. They deserve the chance to grow, regulate, and thrive. And also know that there are consequences, but that it's in a safe environment, by safe parenting, and in a loving place. Thank you so much for watching this video. And if you think this was a good video for you and you liked it, subscribe to my channel and hit the like button, and please leave a comment and let me know if you as a child suffered from ADHD and were not diagnosed, or you have a child that you suspect has ADHD. My recommendation is to get them evaluated. And it is important for the child to be medicated, because it is imperative that the child can be able to learn when they're in a classroom, and also how to manage their behavior. And so both the parent and the medication can work together in helping the child thrive and do well in their relationships, in mood regulation, and also in the classroom. Thank you again.